Let's discuss about an autoimmune disorder which is cold mediated autoimmune hemolytic anemia. This cold antibody mediated autoimmune hemolytic anemia, in this condition monoclonal IgM type of autoantibodies are seen, whereas in case of warm mediated condition we see the IgG type of autoantibodies, but in this condition we see monoclonal IgM type of autoantibodies. In this condition the optimal temperature of the preferential binding is seen at the temperature of 4 degrees centigrade, on average 2 to 4 degrees centigrade. At this condition, these autoantibodies get bind with the RBCs and causes lysis and leads to intravascular hemolysis condition can occur in this condition. And pathogenesis involved in the development of cold agglutinin disease, which is a cold mediated autoimmune hemolytic anemia. As it causes hemolysis, the patient presents with the dark urine and other pale skin and fatigue, weakness symptoms. We have seen the pathogenesis and also symptoms presented by the patient of cold antibody mediated autoimmune hemolytic anemia, and this condition is less common than that of the warm type, and we also see that the severity in the patients or symptoms also will be less compared with the warm mediated autoimmune hemolytic anemia. Cold antibody mediated autoimmune hemolytic anemia. This cold antibody mediated autoimmune hemolytic anemia is a monoclonal IgM antibody mediated binding occurs to the RBCs, and the optimal temperature for the preferential binding is 4 degrees centigrade, that is around 2 to 4 degrees centigrade. This condition can be primary, mainly idiopathic cold agglutinin disease, and this cold agglutinin disease is has chronic indolent coats. On exposure to cold, a complement activity starts at lower temperatures, and this phenomena is mostly seen intravascular and also partly extravascular, and these precipitates complexes often get deposited in the peripheries, leads to acrocyanosis and Raynaud's phenomena. Raynaud's phenomena is nothing but the limb ischemia occurring when exposure to colder temperatures, and at high thermal amplitude leads to aggregation of red cells in the cooler peripheral circulation, and as a result of it the patient experiences acrocyanosis and the Raynaud's phenomena. And this condition, cold antibody mediated autoimmune hemolytic anemia, is not as severe as that of the warm type, and the treatment modality that is used for the patient here, the rituximab is the drug mainly offered to the patient suffering with cold antibody mediated autoimmune hemolytic anemia. Rituximab is the drug which is used, which is a monoclonal antibody, which is anti-CD20 antibody is used in this condition. And this is in brief about cold antibody mediated autoimmune hemolytic anemia, and thank you for watching.